we were aware of each other's work, so the Leonard Cheshire Disability and Inclusive Development Centre?
Yes.
A title that still occasionally stumps me. We were aware of each other's work because I'm a co-director of the UCL Centre for Intellectual and Developmental Disabilities Research. There's Leonard Cheshire, but we'd never found an opportunity to link up. So the Global Challenges call came out and we thought, okay, let's do something focusing on disability stigma around the world. And we were linked up by the director of the Leonard Cheshire Centre, Nora Gross.
For me, we've had impact in a number of areas, and actually probably one of the most significant outcomes for me, certainly professionally, has been a long-term sustained collaboration actually with Katrina, and I think that's really enriched our work, and we've applied for several grants. Hopefully one of them will be successful. We've also had impact, I think, in terms of policy, we've had impact in terms of education and impact in terms of advocacy, and maybe do you want to say a little bit about the work you did, the UN work? I think that was really impactful.
Yes, I think two of the things we did, sort of linking up from the findings from our global review. So we first produced a briefing for the UN in spring of 2015 when they had a special meeting around the right for global education and how children with disabilities very often miss out on that. So we wrote a briefing which went into consideration for that. And then we were invited to present to the 18-people commission in Geneva, who basically are tasked with implementing the UN resolution on the rights of persons with disabilities. Now, there were two things about that were very exciting. First of all, to have the opportunity to directly tell them that they need to be doing a lot more to think about stigma and to think about people with intellectual disabilities. This was an 18-people committee. Very interestingly, when I prepared to turn up there, 6 of them had visual disabilities, the other had all sorts of other disabilities, and there wasn't a single person with intellectual disabilities on this committee. So again, people were completely marginalized. And there were then lots and lots of questions about, we probably need to have somebody, but we're really worried what this means. And a year later, sort of addressing lots and lots of their fears, worries, and actually saying, guys, you will manage. And a year later, the first person was elected with an intellectual disability, Robert Martin from New Zealand, who now represents people with intellectual disabilities at the higher level. So for me, that was an incredibly exciting outcome, even if it sort of going there made a tiny bit of a difference and said, guys, this is not good enough, get on with it. So my research in the past has been very much focused within the UK and European countries. So this was my first proper move into global health and global disability work. The same for my collaborators. So we worked with Professor Richard Hastings at the University of Warwick and with Dr. Shirley Werner at the Hebrew University of Jerusalem. And for both of them, this was their first move, and I think a really eye-opening, and we had lots of very interesting conversations about the very different ways we think about disability, how we assess people, what sort of interventions we consider. So that was very exciting, and there's now all sorts of new global health groups at UCL, and now I've become engaged with those in trying to really think, well, I can have a lot of impact in the UK, but my work can have vastly more impact if I look at places where there's next to nothing going on around intellectual disability and stigma.
And I guess it's the opposite for me. We had a very broad focus on disabilities sort of in general, and actually trying to look at specific impairment groups, and one of the most marginalised and excluded groups in certainly in the international work we've been doing is people with intellectual disabilities and learning disabilities. And I think that's trying to use some of the knowledge and learning and expertise of Katrina and colleagues to really shed some light on how we can do better, whether it's deliver better education services, deliver better health services, better jobs for people with intellectual disabilities. I think that learning from that is really, and there's a lot of work to do in that area. And I think the second thing I'd say is that I don't think it was necessarily a result of what we have done, but there's been a sort of real shift in how we think about disability globally, and there's a real realisation that intellectual impairment and stigma are really huge facets of why people with disabilities still don't enjoy the same rights as everybody else. So there's now a really global shift towards looking at stigma more generally, and I think that that will hopefully lead to further work in this field. And I think it's a really it's important and huge shift in the terms of broader disability issues to really understand stigma.
That's great.
I think advocacy work. I think that, one of the things for me, certainly was the day that we had the 15th of July, and people with learning with intellectual impairments were very much part of that day. And I think it was, for many people, for certainly some of the audience, it was a bit like you've just told the story about the UN. It was a chance for them to really see that actually, they can be part and parcel of the same conference, the same, enjoy the same opportunities as everybody else. And I think that sort of leads to, that's a really strong advocacy message, to act, do what we say we're doing and believe in what we're doing. So I think in terms of raising that profile, I think that's hugely important. And do you want to say something about education?
We've held quite a few more public events since, and always bringing people with intellectual disability, advocates, third sector organisations in and so on. The other things we've done, and that I think is very much led on from Grand Challenges, to really think, okay, this has been so fruitful, engaging with people in the private sector, in charities, advocates, parents and so on. How can we do that more effectively? So we subsequently got another Grand Challenge small grant on justice and equality, and set up a whole range of social media resources. We recently set up the UCL unit for stigma research, and with the support of UCL, we've been able to set up some very exciting social media. So we've got a blog where contributors from all around the world are welcome to write about the work they're doing and the insights within their places. We've got a YouTube channel where some of the research we've recently completed, together with the collaborators we met as part of this project in Nigeria and Kenya, we made a film with them to tell their own story, which is now visible on our YouTube channel and has got lots and lots of hits, and there's never been a dry eye in the house, because it's incredibly challenging and very, very moving to watch.